Welcome to Trials and PIs at EuroPCR 2011. Here we have the privilege to be with Dr. Hofma from the Netherlands, who presented here a great trial, the XAMI trial. Could you tell us what is the rationale of this study?
Well, the XAMI trial is a trial which was designed to use the second generation drug-eluting stent in acute MI, because the use of drug-eluting stent is still controversial in acute MI patients because of evidence of delayed vessel wall healing, endothelial dysfunction and inflammatory reactions to the polymers. And by now we have newer generation drug-eluting stents like the XAMI stent, which has in animal model improved healing, less endothelial dysfunction, and their polymers are more hemocompatible and biocompatible, but there are no randomized trials up to date about the use of secondary drug-eluting stent of the newest generation drug-eluting stent in acute MI patients.
Okay. So who were the two stents compared? What were the comparative arm?
Yeah, it's a multicenter randomized trial comparing the first generation, at that time gold standard sirolimus-eluting cipher stent, to the second generation XAMI stent, everolimus-eluting stent.
Okay, very good. So tell us about the results.
Well, actually we already know from other studies that cipher stent is doing actually very well, has low percentages of re-interventions and was proven superior to bare metal stent, but there is the risk of maybe increased stent thrombosis. And actually we found very nice results in this study. At 1 year, the MACE, being cardiac death, MI, or any TVR, was only 7.2% in the cipher group and even only 4% in the XAMI stent. And this was a non-inferiority trial, and non-inferiority criteria was very clearly met.
Okay.
We even had a p-value of 0.08, and if you look at the curves at 1 year of the MACE, you see at 1 year the curves are still diverging, so in favor of the XAMI stent.
Okay. So any other things you found from that study based on the patient characteristic, the outcome, risk of stent thrombosis?
Well, one of the other important findings of the study, I think, that this is a contemporary acute MI study. We had a 1 year cardiac mortality of only 1.9%, and in the XAMI stent even 1.5%, while this is an all-comer infarct trial with almost no exclusion except for deep cardiac ischemic shock and intubated patients, which you cannot ask get informed consent. So there were very few exclusion criteria and still a very low mortality. And we think that next to the stents, this is also due to contemporary use of, for example, more than 50% radial approach to decrease bleeding. More than 95% of patients had high dose clopidogrel loading, 600 milligrams. We had high use of 2B3A blockers, all those kinds. Dedicated system was only a first medical contact at the patient's home to balloon time of a median of 75 minutes.
That was quite impressive. So tell us a bit how you do that. I mean, 75 minutes for a door from the house to the balloon in the cath lab.
Yes, in Holland, in most of Holland, we have a really dedicated system where the ambulance comes to, there's a 911 alarm, the ambulance comes to the home of the patient, and they get the diagnosis from the EKG, and they have direct contact with an interventional center. Even if that patient is very close to another hospital, they don't contact the local hospital, they go directly telephonic contact to the interventional center. At that first contact, we also ask them to give high-dose heparin, high-dose aspirin, so that's already given at the patient's home. They start driving and our team is getting ready, and usually we are already waiting for them, and they go not to the ER, but strictly immediately from the ambulance to the cath lab.
Cath lab. Very interesting. Now, what are the clinical implications then for a clinician? I mean, when you have the first generation that's doing pretty well, and then you have the second generation is also doing very well, so how do you select? What do you do?
Well, of course, in the other studies, we see that beyond 1 year, you have some additional stent thrombosis in at least the first generation drug-eluting stents. And of course, these numbers are not very high, but still it's increasing, especially against the bare metal stent. So now we have a newer generation stent who also has the very low event rate, and even lower event rate, not significant, but at trend than the gold standard, the sirolimus-eluting stent. And we hope, of course, that after 1 year, the additional stent thrombosis rates, because of better healing, because of less endothelial dysfunction, because of a more biocompatible polymer, will be lower and will diverge from other first-generation drug-eluting stents.
Yeah. So what was the recommendation for dual antiplatelet therapy? Was it 6 months, a
12
year?
months.
12 months.
And we do have some data, as we have now in the all-comer Resolute trial, which included 30% of infarcts. We have between 1 and 2 years in the Science V arm, almost no additional stent thrombosis. And we also, which was reported at the TCT last year, the 2-year follow-up of the subgroup of the COMPARE study, the COMPARE-AMI, but this was not separately randomized, but it was a major subgroup of 450 patients. Between 1 and 2 years, there was only 1 additional stent thrombosis in 450 patients in the science group. So we have some indication that probably after 1 year, we have a less additional stent thrombosis.
Do you plan a longer-term follow-up in the XAMI?
Yes, we have a 3-year follow-up, and we'll have to await this data to first see if the MACE rate curves will diverge more and maybe become significant, and on the other hand, if we will see lower additional stent thrombosis in the newer generation.
Thank you very much. This is a very interesting project, the XAMI trial that was presented here at EuroPCR 2011. And a non-inferiority trial comparing a first-generation sirolimus-eluting stent and a Science V everolimus-eluting stent. And the criteria of non-inferiority were met, and actually it was a diverging of curve up to 1 year. And this was really a highlight of this EuroPCR meeting.